threadlift. We got a question from our fans and customer inquiring about threadlift. So threadlift is basically what it sounds like. We're using threads to lift certain aspect of your face. Now, which thread are we using? We're using basically PDO um, threads. These are basically surgical material that we use on a daily basis during surgery. The equivalent of that would be PDS. So we use PDO, and on these threads there are some barbed wires that were designed to hold on to the deep dermis portion of the skin, and then we can retract and lift basically the skin. For instance, the jowl, the nasolabial, the marionette line, the lateral eyelids, or even the forehead. And some other people use them around other areas in the body, such as the thigh, the abdomen, and so on and so forth. But most of the time, we use these on the face. The things about thread lifts are that there's no downtime. We make a little small hole the size of the needle, 18 gauge needle on the side of your sideburn. There's essentially no scar, and then we place a thread and through those holes, and then we grab the skin on your jowl at 2 or 3 different vectors, and around your nasolabial 2 or 3 different vectors. Now the threads, they typically dissolve after 3 to 6 months. However, when they were placed underneath the skin, your body responds to the threads as foreign body and start producing a lot of collagen, and the collagen will hold the degree of the lifting for a period of time, about a year and a half. So thread lift, a lot cheaper than facelift or neck lift, but the duration is short. It's about a year and a half after the thread has dissolved and that the collagen has been broken down. But there's no downtime. Cost is very reasonable, so the result is not comparable, but very rewarding if you just have small areas where you want to live. So usually I use thread lift in patients in their late 40s and in their 50s. But when we get into the 60 or 70, I think a full face lift or neck lift would be more reasonable. Thank you.